My husband Terry, who was the love of my life, he was a lecturer at South Devon College. He was a very, very fine singer, like many Welshar, and we met in doing operatics in an opera group in Plymouth. He didn't want to talk about death or dying. I knew it was coming because I knew he had been diagnosed with a very aggressive prostate cancer. Nobody talked about it. They just talked about how to try and get you better. When he went into Rowcroft, they were the first people who actually talked openly about the process of dying in the most wonderful, warm way. I remember that they came in and said to my husband, what would you like? And he said, I'd like a scotch. They said, of course. So the drinks trolley came and they gave him a scotch. Breakfast time. And then one day, 3 days or so before he died, they took his hospital bed and all his sort of things that were around him and oxygen and things like that, and they wheeled it out onto the big patio that's there. And he was looking up at the sky and out towards Torbay and everything. There was a big smile in his face. It just, everything was done, one felt, for his comfort and to make things right for him. It's the most beautiful place.
Hi, my name's Emily. I am a team leader in the community team at Rowcroft, and I am a practicing social worker as well. So I work with a brilliant, and when I say brilliant, I mean brilliant, team of consultants, clinical nurse specialists, physios, OTs, spiritual care, and we all work together and visit people in their own homes, which is why we're the community team. And my role specifically is to support healthcare professionals and patients and families. So we're equally aware of the impact that a physical health problem or living with a life-limiting illness can have in people's lives in terms of social issues, relationship issues, finance, housing, working with young children and young adults. The role of carers and how the impact on families can be enormous when you're looking after somebody, or your roles have changed. There's a huge amount around loss of identity and loss of role. So we genuinely work with patients not just around their physical health needs, but we look at globally what's going on for them and what would best support them to live the best life that they can.